Here is MRI of the neck slash mandible in 55-year-old with history of right-sided mandibular pain and swelling. The patient is on bisphosphonates. So what we see on this MRI is a well-defined area of abnormal signal along the right ramus. It shows low signal intensity on T1 and increased signal intensity on the fluid sensitive sequences, that is on the stir sequence. It also shows increased signal intensity on T2 as well. The overlying cortex appears intact. There is mild subcutaneous edema. Given the history of the patient is on bisphosphonates, features are most likely to represent avascular necrosis or osteonecrosis of the mandible. Differential would include osteomyelitis, especially chronic osteomyelitis, if there is a history of any dental infection or recent dental removal with acute or subacute onset of the swelling. Without that history, features are fairly characteristic for osteonecrosis of the mandible. If there is any further clinical concern of osteomyelitis, we can perform a post-contrast MRI or a follow-up MRI after 6 to 8 weeks after appropriate course of antibiotics.